This is a brief overview of point-of-care testing.
Point-of-care testing is laboratory testing that is performed outside of the centralized laboratory, oftentimes by non-laboratory testing personnel. It can be done at or near the bedside and often utilizes small benchtop analyzers that are portable and most often handheld devices. It allows for a rapid turnaround time so clinicians can make immediate decisions. It offers accurate and fast analysis. Point-of-care testing personnel can range anywhere from assistants all the way up to mid and high-level providers. Point-of-care testing is highly regulated. Some of the organizations that may inspect point-of-care testing include COLA, CAP, JCO, AABB, and CMS.
These next few slides illustrate some of the point-of-care testing done at the Royal Oak campus. Glucose is measured using two different meters, the Express, which is used in the hyperbaric chambers, and the Stat Strip meter, which is used in all other locations. Glucose is used to aid in the diagnosis and management of disorders of carbohydrate metabolism, such as diabetes. Hemoglobin is tested on our HemoCue instrument. It is used to evaluate anemia, blood loss, hemolysis, polycythemia, and other conditions. The ABL-80 instruments are used to test for hemoglobin, which we discussed in our last slide, and oxyhemoglobin, which can be used to determine how much oxygen is being delivered to body tissues. The ABL-90 instruments are used to test for blood gases and electrolytes. Blood gases are used in the evaluation of oxygen and carbon dioxide exchange and acid-base status. Electrolytes are used to evaluate acid-base balance and hydration status. The hemocron instruments measure activated clotting time, which is used to monitor treatment of patients on high-dose heparin before, during, and after medical procedures. Urine dipstick testing can provide information for the diagnosis and management of renal or urinary tract diseases. Urine HCG is used to determine if a patient is pregnant. The nitro test is a pH-based test that is used to determine if there was the breakage of the amniotic sac before the onset of labor. Provider-performed microscopy, such as Fern testing, is used as a confirmatory test to determine if there is the presence of amniotic fluid. IP-hydrion testing is also pH-based testing used for the detection of chemical exposures to the eye. The Piccolo instrument is used to test for BUN and creatinine, which are used to assess renal function. The Coagucheck XS instrument is used to test the INR, which aids in the evaluation of the coag system and monitoring the effects of anticoagulant treatment in patients. The TEG 5000 tests for thromboelastogram, which is a method for testing the efficiency of blood coagulation and may be used to assess the need for a transfusion. The hemoccult test is used to determine if there is fecal occult blood present. Though there are many benefits associated with point-of-care testing, there are some issues too. Oftentimes we see multiple reference ranges within an institution for the same analyte on the same patient population. It can be difficult for testing personnel to maintain their compliance with quality control, documentation, and annual competencies. Sometimes there are pre-analytical errors caused by testing personnel that may lead to erroneous results. Testing personnel may not always adhere with the procedure manual, and point-of-care testing is cost prohibitive when compared to the main laboratory tests. Just keep a few things in mind. Point-of-care testing may not always be the answer. Consider non-lab limiting factors which may be triggers to delays in patient testing. And also, vendors may not offer flexibility in regards to cartridge-based test menus.
As you can see, point-of-care testing offers laboratory testing for the purpose of providing information for the diagnosis, prevention, monitoring, and treatment of disease to meet patient care needs. Thank you for your